Just finished my talk at the FUT discussion table. FUT is not demanded very widely by patients, and also it's not so popular in the last years at medical meetings as well. But there are situations where FUT is clearly favorable than FUE. Examples of those situations are where in female patients who will never really need to shave throughout their lives, afro hair patients, eyebrow transplants where it's important to get long-haired grafts controlling the curvature of the hair. People who like the new technique, long hair transplants. Long hair transplants are when you prepare the grafts with long hairs, so when you transplant it, you can immediately see a preview of the result and no visible scabbing at the recipient area. So in these conditions, FUT is clearly favorable than FUE, which was what I mainly talked about in this discussion table. On the other hand, most other doctors were concerned about how to get fine linear scars when doing strip surgery, and that was their main problem. Some doctors mentioned that they were getting poor scars, thicker than usual. Most doctors think that a scar that is 5 millimeters thick is acceptable, and that some have even problems getting those scars. My experience is that 95 to 98% of FUT scars are maybe 1 millimeter to 2 millimeters, virtually invisible, just like a palm crease, And with hair-bearing scalp, it's impossible to see those scars. So with correct technique, it's possible to get close to invisible scars, even more invisible than what FUE does to the donor area. Most doctors miss the fact that they're always looking at patient factors like elasticity, age, etc. But I think from experience that the most important determinant of quality in FUT healing is actually the surgeon. And the two most important factors that affect the appearance of a scar, a linear scar, is the incision, that is cutting out the strip, and most surgeons have a trouble in making these incisions without actually transecting the hairs at the incision line. Transection a few rows of hair at the incision line results in a wider looking scar. Actually, there's no scar, but there's hairless scalp. So I was trying to explain that. And the second most important is the closure of the wound. And a lot of surgeons, especially ones that don't have plastic surgery training, don't use a perfect closure technique, and therefore they end up strangulating hairs at the incision line, which also ends in more bare scalp. So these two don't actually add much to the scarring, but they actually increase bare skin, which is perceived as more scar. So I think it was a very educating table, and especially new doctors learned a lot from that discussion.